If you've ever stepped out of a cockpit feeling stiff, achy, or just completely wrecked, this episode is for you. Welcome back to Skyward, the podcast that brings you behind the scenes of the aviation and aerospace industries, along with the people who make it a reality. I'm your host, Pilot Mercedes, and today I'm sitting down with Dr. Jackie White, an aviation physical therapist who is on a mission to keep pilots flying pain-free longer.
The captain has turned on the seatbelt light. Please take your seat and fasten your seatbelts. Thank you.
Jackie, thank you so much for coming on today. I am so thrilled to have you here.
Oh, thanks for having me. I'm happy to be here.
Now, for listeners who might not know you yet, tell us a bit about yourself and your journey, where you grew up, how you got into physical therapy, and what eventually led you into the aviation world, because they're not necessarily connected.
No, they are definitely not connected. So as she said, my name is Dr. Jackie. I'm a physical therapist, and I work with aviation professionals and your families. I grew up in Western North Carolina on a super small little family farm where family is everything. It's all of us working together all the time, and it's great. I got into physical therapy specializing in aviation because it just, it seemed like every function that I went to the last little bit, I was just surrounded by pilots and everybody was always just in pain. And I've been working in outpatient physical therapy for a long time. So it's like once people find out that you're a PT, they just tell you everything. It's like my shoulder hurts, my back hurts, my knee hurts. And you're out and about at a party and you're like, God, do I really want to talk about this right now? Um, but yeah, so I remember like as a kid, it's like I'd be out kind of just working and look up and I'd see airplanes and I was like, "Ah, gosh, those little airplanes, they look kind of cool." Like I never dreamed that I would be where I am today, which is kind of cool.
That's super cool. I love it. So kind of that connection of so what actually got you into physical therapy in the first place?
So that was a fun story. So when I was in high school, actually, my cousin, she runs a wheelchair seating clinic out of the Patricia Neal Hospital in Knoxville, Tennessee. And I did my senior project on technologies in rehab and how, just the advancing technologies and all of that. And I wanted to know how that played into just rehab. And what I ended up finding on that full week, because I didn't just watch her do wheelchairs, which was really cool. Like it was so cool to watch her, give like a 5-year old like a little like play switch with her finger, and she could move her little wheelchair and go to wherever she wanted to. Um, I mean, that was
Yeah.
cool. But what I thought was even more cool was getting to just watch. There was a young girl there who had been in an accident, and they told her that she would not be able to walk again. And it was really cool watching her go from she needed like 3 people to help her stand up at the beginning of the week to, I went back, I think 3 weeks later, and within that 3 weeks time, she was standing up almost all on her own. Was it absolutely gorgeous? No, but she was still doing it on her own. And that was the moment that I thought, you know what? That's a really cool job. Like, how cool is it to be able to just help someone get their life back or to be able to do things that they never thought that they could do?
Yeah, absolutely. That is such a purpose-filled job, and you get to see the fruit of helping someone go from A to B and actually see them n- be able to walk again for this example. Like that's just so rewarding for them, for you, and an amazing experience too.
Totally. Like I couldn't, it was that moment that I was like, I started doing all the research and, I was like, gosh, how long, what do I have to do to get here? And, it was a 4-year bachelor's degree and then a doctorate degree. And it's just like, okay, looking back on it, I think, oh my gosh, like I went through 7 years of school to be where I am today. And I'm thinking that's just, I mean, it was so much work, but it's so worth it. So worth it.
Yeah. So take me a little bit through what it takes to become a physiotherapist, because I don't know anything about that. You just said about 7 years to actually go from A to B. So what exactly is that process?
Yeah, so most schools they require you to have a 4-year undergrad degree. Doesn't necessarily matter what it's in, but there are certain prerequisites that you have to have, like physics, biology, chemistry, human anatomy, and physiology. I think there's a little bit of psychology in there. But then you go through another application process for you to get into grad school. Once you get into and even prior to getting into grad school, they want to see that you've actually looked and assessed the field. And so there's most schools now, I believe, require between 250 to 500 hours of you just shadowing someone in the.
Wow.
Yep, and they want to see that you've seen the various fields that physical therapists can work in. So there's like outpatient, there's like women's health, cardiovascular. Some people specialize in like inpatient, sports, um, geriatric rehab. There's so many. Um,
Yeah.
but yeah, so schools look for that, and then once you get into school, it's another 3 years, and you're just, you get 2 weeks off typically between your semesters, but it's a lot of didactic work followed up with clinical work where you actually get to go into the clinic and work underneath someone and really just work on your hands-on skills and, work with
Mm.
patients but you're still under a watchful eye and getting all that education. Once you get past the 7 years, then it's you sit for your national board, and it is probably one of the most nerve wracking experiences of your life because you're in the testing center and you're like, oh my god, all seven
Yeah.
years that I have just worked for comes down to this like one pivotal moment, and like if I don't pass this test, like that is my career. Like yes, you can take it again, but it's kind of like a check ride for pilots. It's like you want
Yeah.
to pass the first
That's
time,
exactly what I was thinking
right?
about. I'm like,
Like, you wanna pass the first time because you definitely don't wanna have to do it again or be like, "Oh god, I gotta go back and study some more."
well, I love that you made the check ride reference. So a lot of times for pilots, when we fail a check ride, it becomes part of basically our resume. Like, hey, I failed my check ride this first time, and we have to say, this is why I failed it. This is how I would overcome it, and I did pass it the second time, or worst case, third time. But this is what I learned from that process. Is that the same kind of in the test that you take, that you have to note that I failed the first time, but I retook it and this is how it went, or no?
Not necessarily. So, I think if somebody really wanted to, they could go back and they could pull your scores, they could look at everything. I know that if you have failed, like, you can go back through and because you get a full report, it breaks it down for you as to, what part you may not have done as well on. So and it breaks it down by questions. Because when we take our exam, there's between 50 to 75 questions that are just test questions. So they don't count for anything. They're trial questions. So if you get them right, it helps you. If you get them wrong, it doesn't necessarily count against you because the examiners are just chucking it in there just to see how it goes. Which is kind of crazy.
Sounds very weird.
Yeah, it's super weird. So it's like the whole time you're like, "God, I hope that I get more of those right." Not that it counts
Yeah.
as like a separate percentage, but it helps to buffer in case you mess up someplace else.
Yeah. So then is it not completely a written exam? It's kind of like hands-on exam with someone one-on-one as well as a written exam?
So by that point in time, once you get to your national boards, it's all written because they assume that for you to have passed your like didactic portion, most schools, I can't remember what the national minimum is anymore, but there's a minimum requirement of hands-on skilled hours that you have to pass, which they build that
Okay.
into the program.
Hmm.
So that's your clinical.
Well, that's
Yeah.
yeah, that's really interesting.
Yeah, most people don't know. You're just like, "Oh yeah, you're a PT. Cool." But yeah.
Now you're surrounded by pilots and aviation enthusiasts and pretty much every day now, and at the time of this recording, you were just at Sun Fun as well. So,
Yeah, we were there. We actually got stuck there yesterday. We were trying to leave. We missed getting onto the taxiway by 3 minutes. And so we got stuck. We were like,
no.
"Oh." So, we walked back and it's like, "Okay, we'll watch another air show today."
Oh gosh.
Yeah, but it was still fun.
But, so what did you choose? What were you able to see at Sun Fun? Just since we're on the topic now.
Yeah, so, oh gosh, what did we see? I felt like we walked through everything. Um, we watched the Stoll planes for a little while, and then we watched I think Wednesday night was the night that they did the first combined day and night show. So
Oh,
yeah,
very cool.
yes, so we went to see that. I always think that the drones are really cool. I just think that I just cannot imagine just, the little guys just, out there doing their thing. But no, the both air shows were absolutely awesome. The one that we saw yesterday was a lot more of kind of like the warbirds. So and I think that the F-22s and the F-16s also flew, but we had walked back out to the plane because we wanted to be the first ones to get out of there. Um, Before. So, but where we were was actually where, like, the F-16s and the F-22s, like,
Oh yeah.
that's where they made their turn. So it was almost like we were right there. There was nobody in front of us. So it was actually
Wow.
a really cool spot to be. Like, you don't realize just how quick, like, that those go. And I actually had
Oh yeah.
patient before he flew one of them. I can't remember which one he flew, but he was telling me all about like their training and what they did. And I was like, this is so, like, it's so cool to actually like see it in person, what he was training for. You're like, wow, that's a lot.
Oh, I can't imagine. I mean, I think it would be a lot of fun, but then you're also surrounded by the stress of actually trying to learn it all and do it right.
Right. Yeah, and I have a really hard time imagining just the G's, like, what that feels like. Like, I've been in an extra before, and I've felt what some of that feels like, and I'm just thinking, "Okay, like, I can't imagine more than what I felt in that."
Absolutely.
Crazy, crazy.
So did you go to Sun and Fun with some kind of a learning mindset of also taking in everything as part of your practice of seeing how pilots are experiencing different ways that their body's affected, like you mentioned the G's and stuff like that. Were you kind of going for some of those reasons as well, or did you have a booth or something like that?
So my partner, he flies and he goes to Sun and Fun every year. Normally he's really bad about telling me what his schedule is prior to. But this year I was like, "Listen, I'm getting better at like managing like my side of, he's a commercial pilot. So I'm getting significantly better at managing like my side of things, being like, okay, he does not plan because their schedules don't come out until like the last couple of weeks of the month. So, until then you're like,
Yeah.
can we do this? Can we do that? I don't know. And so I think last year, like in the last week in December, I went through the entire year, all the air shows that I thought that he would want to go to. I was like, these are the dates. These are the dates that I'm going to take off. And we can do these things. So bid your schedule accordingly. So that's what we did. So I went with him. And his cousin, we actually flew out of the air park Wednesday morning and they went to go, of course, look at the planes and get some parts for their planes and, all that. And I truly went just to meet and greet other people, listen to, some challenges that they might have and just really kind of just embrace this community because it's such a cool community to be a part of, or at least I think it is.
Oh, absolutely. Well, also, I'm quite biased, so in that direction.
Right?
So I want you to go kind of walk us all through how you went from kind of touched on it briefly, but how you went from regular physiotherapy to completely clicking into the aviation track of merging aviation with physiotherapy. What was that moment and why did it click that for you?
Yeah. So, ironically, I was actually working for another clinic at the time, and I think that week I had like 3 or 4 patients come through, and they were all pilots. I mean, at this point, I've been with my guy
Wow.
for a while, and I was just thinking, it's like they get, we go through the whole eval, we look at everything, and then we get to the scheduling part. And it was the most challenging thing that I have ever tried to do between trying to like schedule their visits in between like what I had available when I was in the clinic and then when they were, when they were home from their trips or, and trying to just fit it all in between.
Were they what may I ask, were they all airline pilots, or was it a mix of private and airline, or what was that?
It was actually a mix of both. Most of them were commercial
Okay.
commercial guys, but some of them flew privately for, families or whatnot. And so, it just trying to figure that out. And then, it's like, of course, stuff comes up during the week, like, oh, hey, like I picked up this trip. I'm not coming in. So it's like, okay. It got me to
Yep.
thinking, like, I came home one day and we we lived so we're between Wellington and Port St. Lucie. So in Wellington, across the street, which is where my guy grew up, there's a fly-in community. And one of the guys there every morning at 9:30 a.m., you flew. If you were there on the apron, you got in, you went through your flight, wherever that might be. It might just be out over the Everglades for just a little bit. And then you come back. And so I think it was
Fun.
it was yeah, fun. And then they come back and I called it old manning because they'd like sit in a little circle and they chit chat about like airplanes, taking stuff apart. And I remember coming back one day and it's like all of them are sitting there talking about their aches and pains. And I was like, "Oh my God." I was like, have all like, I'm sitting there and I'm like, "Have none of you guys seen a PT before?" They go, "Why would I do that?" And I was like, "Because like you're too one, I was like, some of you are way too young to be feeling this. And two, some of you have grandkids now. Like you should be able to enjoy your grandkids, not like, worry about like getting more and
Yes.
then not being able to get back up." Or they were complaining about getting in and out of the airplane, how much harder it had gotten. And I'm sitting here thinking, guys, like, what are we doing? So between the scheduling conflicts and then just, some of them just going through the natural aging process and not doing anything about it, I was like, what? Like, there's nobody out there, and I'm sure that there's somebody else, but I was like, it just seems like such a big miss for this community. Like they just don't have the support
Mhm.
that they need and they don't know who to go to. And I think
Mhm.
it's so important to have someone, on the inside that actually kind of like gets the struggle that they experience sometime, whether it be, from the demands of flying or whether it be the demands of, their spouse who's stuck at home with the family. Like, how do we blend all that together into a nice program that's going to fit the various lifestyles that the aviation community has to face? And that's where Skyline
Yeah.
came from. It was like, there is a need and we need to meet it.
So when did you found Skyline?
So I started this company about a year ago. Like I kind of had the idea like a year and a half ago, but I was like, I don't know. Like I don't know if it's going to work. And my guy's like, just do it. He goes, just suck it up and do it. And I was like, okay, fine. So about a year ago,
I love it.
yeah,
And you're doing
and
it.
I'm doing it. About a year ago, I was like, "You know what? Forget it. I'm just gonna try it and we're gonna see, and we're gonna see where this goes." And it has been so much fun. Like, I genuinely enjoy getting to work with this population. And sometimes the struggle of, like lining up schedules, like I don't have that as much because I've kind of taken a little bit more of like a digital approach with it. So it makes it way easier for them to have access to me. Now, am I answering my phone at midnight? Probably not, because I'm a grandma and I like being in bed by like 9:30. But that doesn't mean that I'm not going to respond at like 5 a.m. because that's when I'm going to wake up. So,
Right.
right. But yeah, so it's pretty cool just to kind of get to do
Mm.
kind of whatever with them and meet them where they're at.
So do you kind of do a mix between a digital platform as well as in-person visits, or are you focusing more on just the digital side?
A lot of what I do with my pilots is mostly digital just because they're not always in town. If I have some pilots that are close to me or say that they've like flown into town, like sure, I don't mind. I don't certainly don't mind doing like a little hands-on treatment. Um
Mhm.
but most of it I'm prioritizing more of that digital component. just because I think it flows a little bit better with their schedules and it's a little bit easier for them.
Hey, fair enough. And you can serve pilots all over the continent, basically, and all over the world, too.
Right? Yeah. And selfishly, it also lets me be able to kind of spend a little bit of time with my guy. Like if he has a really cool overnight, I'm like, I kind of want to go in that overnight and see, just see. Like, a month or so ago, he got stuck in Antigua at an all inclusive resort. I'm getting pictures of him drinking his little virgin pina colada, and I'm like, I'm stuck here, like just holding down
I can
the fort over
understand that.
here. Like, that's great. But no, like
You're
there is
like, wish
that,
I was there.
right? Like also very happy for him because I'm like, I'm glad that you are actually taking advantage of this. This is good. So, but also really,
Oh my
because I'd rather be there too.
god. But that's great, giving you some flexibility as well as your patients some
Yeah.
flexibility. So then, what kind of methods do you use to help and really tailor these rehab programs for the various types of pilots? Because there's not only one.
No, yeah. So for all my pilots, what I do is it's like the first week I want to set it up to where one, I want to set expectations. I want to make sure that we are both on the same page because it's super important that like I understand what they want from me and they understand what I want from them. And a lot of that
Mhm.
first week is just kind of assessing. Like, I want to see how you're moving, what's bothering you, especially if it's kind of, it's coming back from an injury or we're looking at being a little bit more just kind of injury prevention specific. So I'll set them up with there's a core set of videos that I always want to see out of my folks and I look at everything. I'm looking from head to toe to see, how we're moving. If I notice a little something, I'm going to probably ask for another video that kind of gives me a different angle. And then I'm going
Mm.
to send them back a video of just my overall assessment and kind of set up that game plan for them. The following subsequent weeks, it's all about programming. It's based on what I saw in the assessment, and then it's also based on their days. So, are you working out at home? Do we need to try to incorporate your kids into whatever you're doing? Do I need to look at your hotel? It's sometimes for some of them, they get to a not so hot hotel and they'll just snap me a picture of what the hotel looks like. And I'm thinking, okay, this is how we're going to modify this. This is how we're going to modify that. And we're still going to make it an absolutely killer workout, depending on whatever they need. So, and that's just kind of how I go through it. But I've also set up little kind of like checkpoints, right? Because I also want them
Mhm.
kind of thinking and reflecting on, how things are going, what do we need to improve? What are some challenges that they foresee coming up and how are we going to get through those challenges, whether that be, I have a 6 leg day and I'm going to be absolutely exhausted today. Okay, cool. Well,
Oh my
maybe
goodness, yeah.
it's like, well, maybe today isn't the day that we try to do an hour workout. Maybe today is a day that we just, we're really happy with a quick little just mobility routine that we can do in the hotel room, not on the hotel floor because hotel floors are absolutely disgusting and it's a scary, scary place. But we're going to try to kind of modify some things, to work with that schedule. Also thinking about like nutrition on the go. It is a
Mhm.
constant battle for me here on my end with my guy of, we're constantly looking for different snacks that he can take with him because, it's sometimes it's like life happens. Sometimes flights get delayed, they get canceled. You can't necessarily get to food. There's not food on the flight for you. And some of it,
Absolutely.
right? And it's things that it's like you're not necessarily prepared for that just happens. So it's like, how do we prepare for these things and
Yeah.
know how to get through them? So I try to be pretty inclusive and everybody's different. So, some people are like, I want to work out, 6 days a week. And other people are like, no, like, I really just need a couple, this is more of what I need. And they need just a couple of days. So everybody's so different. And so I'm going to curate those programs specifically to what they're telling me that their core needs are. So,
Mhm. So then depending on that first assessment, do you actually get some of them in more of the traveling pilots and stuff like that? Do you have them buy some certain equipment that they can take with them, like stretch bands or different things like that? Or do you really just focus on body weight, physical therapy kind of movements and whatever equipment's at the hotel?
Yeah, so it depends. There's a couple of things that I absolutely love for folks if they're traveling. One of them is lacrosse balls because one of those you can
Oh,
shove it down in your shoe. Nobody knows it's in there, or like shove it in your flight bag. And it's something that it's like you can use when you get to an airport. It's a great little trigger point release tool. Is it a permanent solution to the problem? No, but is it going to help give you some temporary relief when you're just feeling a little stiff and a little tight? Heck yeah. So I will almost always
uh,
tell people to have one of those, and they're not too expensive. I think a pack of 2 is like $6 on Amazon. So I have one in my work bag. I have one in my car. Like there's one at my gym in the hangar. They're everywhere. Um and then the other thing that I love is like a little cloth band, like loop band set. You can do so many shoulder and leg and core exercises with those things, and they fold up into nothing. Again, you can roll them up, shove them in your shoe, and they don't take up any extra space. It's just kind of like having an extra couple of pairs of socks, except, they're for your fitness.
yeah, that's
So
fantastic.
yeah, those are not the only 2 things that I'm like, like if you're going to buy something, that's what I normally recommend them buy, but otherwise, no, we can totally use whatever the hotel gym has, but if you don't ever wanna go down to the hotel gym, those things are I can come up with some pretty good stuff with those and get you.
That's awesome.
Yeah.
Yeah, that's great. So then what are some of the very common physical complaints that you see from pilots and crew members? Let's focus on airline pilots to start with.
Yeah, so one of the biggest things that I see with them is low back pain. It's a pretty common complaint anyway in like the general public, but I hear it a lot more in pilots as well. And some of that I'm attributing to, you're sitting in these cramped cockpits for extended periods of time. You're in this flex position, so, it puts a lot of extra strain on just the hips, that low back, the just legs, lower extremity in general. Um, the other common complaint that I get is a lot of stiffness in the neck and even the shoulder. A lot of that I think comes from just postural fatigue. If you're having to sit upright, if you're having to, in some of the bigger commercial planes, if you're having to reach up and flip the switches, those cockpits are really small, so they don't necessarily optimize just posture and positioning all the time. Um,
They weren't designed by a physical therapist.
no,
That's for sure.
they most definitely were not. I mean, every time we also have like a little RV8, and it's like, when I always ride in the back of that thing. So it's like when we take that from Florida to North Carolina, it's like sometimes by the time we get up there, the 3.5 hours of just sitting with my knees almost like into my chest, I'm like, all right. Like, I need to move around. Like, when we get out of the plane, it's like we're both doing stretches. Like, we probably look
Oh, I bet.
old when we
Absolutely.
get out of the plane, but I'm like, no, this is important. We are taking this 5 minutes before we start unloading this thing, and we're going to take care of ourselves for just a hot second. So, but yeah, it's that just those cramped positions, they wreak havoc on the body.
Yeah. Well, I think there's a thing that I heard somewhere where sitting is the biggest killer of, adults these days over anything else is just the fact that we're sitting so much. I mean, speaking for myself, I sit at this desk with shooting this podcast. I sit at work, and then when I go flying, I'm sitting. So I'm doing, or if I'm sitting, I'm sitting. I'm like, this is a lot of sitting, like all the time. If you're not sleeping, you're sitting.
Wait, and it is so true. Like if you think about it, like it's funny because I stand and I'm constantly moving all day long. Like I never sit still. So it's like when I do sit still and have those days that I sit still for a long period of time, I'm like I cannot imagine how people do this all day long, And it's like, no,
It's like,
it's
when you listed the back issues, I'm like, "That's exactly what I've been dealing with," and I'm, like, trying to start incorporating some movements here and there so that my lower back and all of my hips are not so stiff and achy, and I'm like, "I'm 26 years old, I should not be feeling like an old woman.
right.
I should not be like a creaky." thing.
Right? Yeah, you're like, "Oh, this is terrible." And it is, and it's crazy because it's like the older that people get, the worse that it gets because, our tissues, they change. They don't have as much collagen. The elasticity of the tissues isn't as great.
Our
So
hormones change and everything like that.
change, we get, there's some joint changes, some like ossification that ends up happening, arthritis that we end up starting to see in places. So I mean, one, the aging process isn't necessarily fair either. Like it it
Mhm.
is not an easy process or for the faint of heart, that is for sure. But there's all these little things that we can do, starting now that will affect us, positively in the future.
Mhm.
And having worked with, so many various populations, it's crazy to see the folks that have spent so much time in their younger years and even made the change in later years where they just start moving again and they're more active and they're more diligent about, what are they putting into their bodies? How are they giving back to
Yeah.
themselves? That we start seeing all these culminating changes for the positive. It's like they're moving better. They're able to fly longer. They're able to spend more quality time with their families and travel how they want to travel. And, for the aviation community, it's fly longer. Not
Mhm.
worry about getting, in and out of airplanes. I mean, aside from like a Piper Cub, which those things, I don't care how old you are, I think that those things are the hardest airplanes to get in and out of for any age group, or no matter how flexible you are, they're just hard. Um, but
I bet. I've never flown in one before yet. I would love to, but I'll have to take your word for it.
they are so hard. We actually put my dad got to fly in one. They were down here visiting and he'd never been in one. So we have a friend that has one and it's like I think it's from like the 1940s and it's restored and like he's fairly limber, but he's in his 60s and he
Mhm.
gets in it and he goes, "Oh my God, I don't know how I'm gonna get out of here." And I was like, "Don't worry, Dad, we'll figure it out. We got you." I got you. But, watching him get out of that thing, I was like, "Dad, your hip mobility, it's so much better than I thought that it would be." I was like, "I've worked on you a lot over the years." And I'm like, "You're doing great, man."
That's
He's like, "You're
awesome.
just picking on me." I was like, "No, I genuinely mean it." So,
That's the best that you can even see it in your own family and friends that you're like, "Hey, you're doing well. You're doing great."
oh.
Oh my goodness. And have you had anybody from more of the aerobatic side of flying and where they deal with different kind of G forces, like you mentioned with the military pilots, and how that affects the body in different ways?
Yeah, so it's the G-forces are actually really cool. I've not read all the studies on them, but as I started getting into this population, I was like, I really want to know how this affects things. And I had actually had one. He had actually taken me up and did like the full like aerobatic thing before, and yeah, this also
Very fun.
happened. Yeah, this also happened when my guy he was gone on a trip, and the guy was like, "Oh, you wanna do something really cool?" And I was like, "Sure, I guess." And he goes, "Yeah, okay, so this plane, this is an extra." And I'm like, "Okay, cool. Like, what does it do?" And he goes, "These are the only rules. You just have to tell me when you don't feel good." He goes, "Otherwise, we're just gonna like roll through it." I was thinking, "Okay, cool, cool. This is gonna be great." I had a great time. It wasn't until we went to an air show actually that I was like, "Oh my god, that's what we did. That's what I experienced." I was just trying to figure out like where I was in space and what my body was doing. But coming back to your question, one of the things that he complained about constantly was shoulder pain. A lot of shoulder pain on the front of the shoulder. Why? If you think about it, when you have all those G's, they're pushing back against you. You have to keep the stick in a more forward position in order to complete the movement. That's a lot of pressure and a lot of stress on that bicep tendon, deltoid, all of that up in there, which are all muscles that help to push that forward. Then you have to
Interesting.
Right. So then you have to think about it. You have to have a lot more shoulder stabilization going on from all the other muscles. So like your rotator cuff has to act to stabilize the shoulder while you're performing that movement through its entirety. So, when you think about G's, you also have to think about even if you were doing like, some of them talk about doing like bench press and things. You also have to factor in the weight that the G's are producing on that tendon. So it may be the same thing as you pushing, 100 something pounds up off your chest based on the amount of G's. So, a lot of my pilots that are doing, more acrobatic stuff, like I'm definitely looking at all the shoulder stabilization structures because I want to make sure that that shoulder can withstand those G's as they go through all of their training. But that's one of the biggest complaints that I've gotten from that population.
Yeah, that's really interesting because I'm like, I've never actually thought about how it affects your tendons, your muscles differently, other than just getting in and out of an aircraft. But each pilot experiences that depending on what their job and their activities entail.
100%, yeah. And it's interesting just each aircraft too and styles of pilots, like they all fly just a little bit differently and they have certain things that they like to do and yeah, it's really interesting to see just the effects that it has on the body as well.
Yeah, absolutely. And then have you had any kind of like flight students or flight instructors or people like that where they're only dealing with the small kind of like GA style pi aircraft and flying every single day? Because I used to be a flight instructor, and that was my every single day, just sitting in an aircraft with another student on rotation.
Um
Any of those?
Yeah, so my partner, his brother-in-law actually just went through um flight school and got his private and did his commercial
Good.
and he's now working towards his CFI and working towards his time building. So, they're he was a personal trainer in the past. He's actually who, from a different standpoint, I would send clients to if they were down that way and just needed someone that was like right there. But it was really interesting watching him go through the program because, it's you almost go back to being those you're a student again. So I mean, when you're a student, you are studying all the time. You're hunched over your desk, you're stuck in those small, what is it? The 152s or the one the
You can do 152s, 150s, 172s, Piper Warriors, PA 28 161s, like
yeah, so,
all these.
I'm thinking about those, like they've got a little bit more space in them. But it's still like when you're sitting in that same position, it's that prolonged sitting that just it's so hard for them. So one of the biggest things that I've always told that population is it's like take your breaks. Like when you are done flying, take 10 minutes or even just 5 minutes. 5 minutes is better than nothing, but 5 minutes goes by really quick if you when you think about it. So I say take 10 minutes, take a lap through your building or if you just need some fresh air, just take a lap outside. And when you get back, there's like a quick little mobility just thing that you can do, whether it's, reaching up towards the sky, reaching down towards your toes, doing a little bit of rotation. I call them thoracic rainbows, but you kind of get up against a wall and you're just going like up and over with your arms. So it's going to really work that spine through just the whole range of motion. It's going to restore blood flow back. And a lot of those things, it actually helps to reorient you as well. So if you've been studying for a long time, one of the things that they recommend is actually every hour, get up and move. So for students, if you're studying a lot, try that and see if that helps to just recenter you. When you come back to sit down, take a quick review of what you were looking at before you left, quiz yourself really quick, and then, move on to your next study topic and see if that makes a difference. For CFIs, it's just take that moment to just, one, decompress from, flying with your student because sometimes those can be rough life experiences as as I have heard. It's kind of like teaching a kid to drive a car except now you're in something that it's going a lot faster and there's, the
It's
air, the percentage
three-dimensional.
of air significantly higher if you do something wrong. Um, so, I always tell flight instructors, take that moment for yourself, decompress, take that lap and drink water. what we don't do is we don't drink as much water as we should. I'm guilty of it as well. You
I
know,
failed at least, flight instructor days in the States. I totally failed that in Florida. It was, not my brightest moment. I still struggle with it. I have a drink right beside me here, but
and
trying to remember to actually drink until I'm, like, completely parched, it's a work in progress.
it is so hard to stay hydrated and make sure that you drink enough. I mean, I'm the world's worst. Like especially if I know that we're going to be flying somewhere for like a long time, and I've got 3-4 hours in that plane. I'm gonna slowly sip as I go just to try to kind of stay hydrated. But a lot of times, if I know that I'm
You don't wanna go to the bathroom or want to go to the bathroom in the middle
right.
of the flight.
Yes, yes. And especially being a girl too, it's like I don't have a pee tube. I can't do that. So, it's like a lot of times if I
Exactly.
know that we're flying for a long time, I'll mix in some sort of like electrolyte in with my water, something that's low in sugar, um, relatively low in sodium, but I want something that's gonna kind of like give back to my system while we're flying. So and then when we land, I'll try to finish it up so that way then I can kind of like get back to re-normalizing myself. So that would be another good fun tip.
Mhm. And then I would like to just touch on the nutrition part because you kinda touched on it at least for your partner. What should we be focusing on as pilots from being a student, from a CFI? You kinda mentioned commercial airline transport pilots. What should we be focusing on different areas depending on our skill, expertise, or job type? Or is there kind of a broad thing that we should all be focusing on?
Yeah, so one of the things that I find for this industry is it's not necessarily sometimes it's access to food. It's a huge challenge because, say that you started your day late or you got called into work super quick, you didn't necessarily have time to pack your snacks like you needed to. It's and then you get to the airport late and then you're looking at like, "Oh my god, then you get there and then there's no food on the flight for you." So now you're like, "Oh my gosh, when am I going to eat?" So something that I will always tell folks to do is when you get home from your trip, restock. Get something, like a little like nut bag or like some dried fruit, something that's going to offer a little bit of like substance. And for some people, I'll even tell them like if you have like a little like they make really good like protein powder drinks now that it's like a little protein packet. And you can just mix that in with your water so you're at least getting something that's going to sustain you throughout that time. Um, is it the perfect solution to, actually getting, like, a full meal? No, but it's better than having nothing in your system at all and your body just running on reserve stores, because we want you flying at your tip-top shape, and when you have reached the point that there is nothing left in your body starts going into this kind of like fight or flight mode. So it's going to start taking care of itself through using your energy stores, which actually
Mm.
makes you more fatigued than what we want. Then, if you think about it, you haven't eaten all day. Then we want you to go work out. Your body is already at a fuel deficit. So, it's like you're still trying to push through, and your body doesn't have anything in it that can give back to the muscle. So, you know, biggest thing is think about what you're doing before it happens. It's like one of the biggest things that I tell folks is find a snack that you love and keep it stockpiled. So then when you're going to leave, you can just grab it and go, or it's something that you can just stick in your flight bag before you even leave. If you ate it on your trip, awesome. You get home, you restock it. It's something that's almost always in there and readily available. So, I mean, I do it for myself for like anytime that we fly, or even just in my day to day. I always will keep like a protein bar or like a quick snack in my bag, something that's going to refuel me because there are some days where it's like I don't necessarily get to where I need to get to get the actual food. And I'm sitting there at 4 o'clock and I'm like, okay, cool. Like I started really early today and my day just kind of like, my day fell apart. Like this happened over here and I needed to go fix that. And then I needed to come over here. So, while it's not always aviation, like some of us still struggle with that. So, Am I perfect?
Oh yeah, I can
But
completely relate to all of that.
it's like, am I perfect? No, but do I have the tools, like, built into my toolbox to fix it when it does happen? Absolutely, 'cause I don't know, maybe some of y'all are like this, but when I get hungry, I get a little hangry, and my critical thinking skills definitely start to plummet rather quickly, and then I'm thinking, "Oh, no, like, I can't think. I can't make any reasonable decision at this point in time. Like I just know that the sky is blue and the grass is green and I'm really hungry. I don't care what I eat. I
Yeah.
just want to eat something. So we want to try to
Yeah.
avoid those moments as best as we can.
Mhm. Absolutely, yeah. You can't really think straight when you're trying to study or trying to fly an airplane or anything when you're really on an empty stomach because you kinda go into, as you said, that kind of survival mode almost a little bit. Your body's just like, "I need something now," and I've definitely felt that I'm a little more self-aware as I've gotten a little bit older, so I'm like, "Okay, time to eat because I can't solve this problem at work or focus on this thing while I'm studying because I haven't eaten in like 4, 5, 6 hours. It's time.
Right.
It's time to restock and come back, and maybe I'll be a little less frustrated with this problem, and it's not as big as it actually is.
Right. And it's so true. Like that's one of those skills that I actually picked up when I was studying for my PT exam was
Hmm.
one of my coaches told me he was like, every time that you get a chance to take a break in your test, he was like take it and go eat. He goes whether it's just a handful of nuts, he goes you're not going to want to eat, but eat. And I did so much better and felt so much more relaxed my entire test because I wasn't just like my brain, your brain is a muscle as well. It requires energy in order to function. So if it doesn't have what it needs, it's not going to function at its highest level. So food
I used to just think I would just be able to go through, like just push through, keep pushing through. It's like, no, it's not the same way as, like, regular muscles, you actually have to help it out a little bit, it's a reward system here.
100%. That is a great way to look at it.
Now, what are some non-negotiable things that every pilot should be focusing on? We've talked about some movements, we've talked about some nutrition, but is there something that everyone should be doing no matter what?
Yeah, so one thing that I tell folks, it's all like without a doubt a non-negotiable is building in those structured movement times. Whether that means that you have a mobility day or a strength training day or a cardio day or you're trying to marry all of those together, which is excellent. Like I'm definitely not going to say no to those. Um but any little bit of movement that you do now just helps and goes into your longevity bank. One thing that I always tell folks is you should always, 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 without a doubt, have at least 1 to 2 days that are solely focused on mobility, especially because this job is you're sitting for a long period of time. You're not necessarily getting the blood flowing as well. So that mobility is going to help with connective tissue and soft tissue. But then taking
So when you say just to, interrupt for a second, when you say mobility, what does that mean exactly?
Yeah. So, what I mean is taking those moments to stretch, put yourself into some of those positions that are going to elongate your tissues. So, like a nice little hamstring stretch, or where a lot of times I'll have people lay on their back, bend their knees, and then just let their knees fall to the side. What that does is it helps to move that lumbar spine just a little bit and help. It almost gives you like a little self massage for your low back. Doing things where you're going to stretch your arms, reaching up overhead, anything that kind of gives you just a little bit of that nice gentle pull through the tissue is considered mobility in my opinion. Um, you also just want to get the joints moving through their full range. So, whether that's reaching up towards the sky, like the shoulder has a total of 180 degrees of movement, which is a lot. It's the most movement out of any joint in the body. So we want to be trying to get that shoulder through everything because we don't want to lose it, especially from sitting in those static positions. The other thing is walk. In between your legs. Don't just go hang out in the pilot's lounge or in, whatever lounge you can find yourself in. Um, Take a walk, and let it be a 5 to 10 minute walk to kind of get your heart rate up just a little bit. that is so important, especially from sitting for so long. And then just that short little walk, like it helps to reduce your risk of getting like a DVT, which is a deep vein thrombosis. Those are, they're definitely not something that you ever, ever, ever want. A lot of swelling that happens in the lower extremity, especially as we age, that walking becomes even even more important. And then strength training, like don't forget to strength train, even if it's just light resistive training. Like it doesn't, I'm not telling you that you have to get out there with a barbell and go squat 250 pounds. Like that's not everybody's style. Like there is a style of fitness for everybody, and if lifting a barbell is yours, that's great. I mean, don't get me wrong, I love working out with a barbell, but that's not what I do day in and day out. There's some days where
Mhm.
just doing like lighter stuff where we're looking at resistance bands, or doing kettlebell work or dumbbell work. Like there are so many different things and so many different movements, but as long as it is functional and relevant to you, that's what's important.
Mm. Can you share a quick success story, kind of incorporating all of these very good points that you've made throughout this conversation so far?
Yeah, so oh gosh, I'm trying to decide which one I like the best. Uh,
Like, sure, a couple if you have a couple like specific ones with different issues.
Yeah, so one of my favorite ones was probably, he was a younger pilot, had a lot of low back pain, and just always on the go. So it was like finding the time to build him programming and get him on his program. Some of that was a little bit of a challenge, but we worked past that. And but it was really cool to watch him go from, he all he did was kind of like walk in between his flights, which was great, and I loved it because I was like, "Dude, like, he was in Dallas a lot, so it's like, walking that
Mm.
airport, like, you can easily walk 4 to 5 miles in that airport and not even know that you walked it. You're like, "Wow, okay, cool." Um but yeah, once we finally got him on a program, like we spent 6 weeks just working on just kind of building up those really good habits, building in like, the certain working with his schedule where, it's like some days he had 3 days in a row that he could work out, other days there were only 2 days that he could work out in a row. And we just kind of worked around his schedule. Multiple times he sent me, pictures of the hotel gym when he got there, and he goes, "Hey, like my plan is to work out tomorrow morning. Does my workout, are there any changes that need to be made, because this is what I'm working with." Fortunately I get up super early, so it's one of those things. It's like, I just fixed it real quick for him, whatever needed to be done. And a couple after 6 weeks, he was like, "Okay, my back is feeling a lot better. I'm sticking with my program. I'm consistent. I'm growing." And we've kept working together for quite a bit of time after that. He just continues to make improvements and get better, and his training continues to elevate and improve, and which is really cool. It's cool to see like where he started and where he's at now,
Yeah.
how much better he's doing. We're still working on the whole snacking thing, but let's be for real. Like all of us are going to have a day where we're like, you know what, the burger or like the Cheetos are just they're just what your body's telling you that you need. Um so but we're working past, we've at least got a snack routine down now too, which is really cool to see.
That's amazing
Yeah.
that you're able to go from, like, really bad back pain to actually making very positive progress and then sticking with it and then just building on that what you've like, that foundation that you basically created and then building upon that. Like, that's fantastic.
Yeah, it's really cool and it's really fun. Like I genuinely enjoy programming for people and being like, "Ooh, like, how is this exercise going to do for them?" Or, I wonder what their thoughts are going to be on this one, because I think this one's great. And the other part is
Mm.
I'm never going to give somebody something that I haven't done or tried before either. So, if I'm giving it to you, I've probably done it. So it's, if it's a great exercise and it has a like high level of fatigue and difficulty, then I am here for it. I'm like, "Ooh, I really wonder what the feedback's going to be on that one." So, It's cool. It's really cool for people to come back and say, "That was so hard," or, "Oh my gosh, that was not what I was expecting," and I'm thinking, "Okay, cool, like, I'm gonna keep that one in there because eventually with more repetitions, just like with learning how to fly, the more reps that you get in, the easier it becomes. You develop muscle memory, you develop muscle strength, and eventually you're thinking, "Oh my gosh, okay, cool, like, I can do that, let's make it harder."
So then I was just thinking of something that when we're training as pilots dealing with our Cessnas, our Pipers, and stuff like that, we oftentimes use more of our right leg versus the left leg. Do you find a lot of pilots are kind of unbalanced more in the dominant side, either right side or left side? And then how do you kind of bring them back to balance so that the body is balanced to strength wise, or at least closer to? Like, how does that work?
Yeah, so there are actually some really cool muscle energy techniques that we can do. What happens a lot in pilots, especially in some of like the smaller planes, and just like you said, where it's like you're using more right rudder versus left, you naturally are going to kind of shift more towards that right side, which is going to cause that hip to come a little bit more forward on the right, just because of how you're sitting. So that's why we actually see a lot of low back pain is because of the imbalance in the pelvis and where all that kind of comes together. Because your pelvis is kind of like your bowl. It's like your foundational piece. It's going to hold everything together. When all of that gets shifted ever so slightly, starts talking a little bit more. So a lot of times I'll teach folks how to do kind of like that muscle energy technique to kind of put not necessarily I don't want to say put everything back, but to help you kind of feel a little bit more neutral again. Um, which is super important because you can like some people will say, "Oh, like I went to the chiropractor to have like and they adjusted me and all this stuff," which yes, it's going to feel better. But I always tell folks you have to think about what's causing it to be pulled out of alignment. It's where you have that muscle imbalance, just like you were saying. So a lot of the things that I'm going to do is we're going to really hone in on that right side. I want to stretch that hip flexor. I want to try to open everything up in the front so that way we're not as tight in the front, but I also want to build up strength in the back. So a lot of hamstring, a lot of glute strengthening as well for that side. But
Yeah, that
we also try to keep you balanced too. So what a lot of people end up noticing is that what they're doing on one side is going to be more challenging on the other side. It just depends on which side is your more dominant side or which side you're using for certain tasks more.
Yeah, that makes a lot of sense. Because I mean, I'm more right-handed and right everything. I can be a little bit ambidextrous, but when I'm in the aircraft, it's more right rudder. There's there's nothing I can really do to avoid that, so that means I'm really right dominant and really pulling my body into one side. Like you said, the chiropractor, I go to an osteopath, which is kind of like just a different version of chiropractor, and I get fixed for repeated things, right? So trying to figure out how to prevent that from happening or at least work with the lifestyle that you're kind of living in at the moment, whether that's a sport or flying, helps a little bit more rather than just constantly correcting the same thing over and over and over again.
Yeah, 100%. And it's all about balance too and just and training and there's so many different things that we can do. And what works for one person doesn't necessarily work for the other person. So that's where it's sometimes it's trial and error when you're programming for someone because you're like what worked for person pilot A is not working for pilot B. So it's like, okay, cool. Like I've got to change what I'm doing and figure out a different option for them so that way they still get the benefit. Which I think that's the cool part about what I do is not every person is the same, and some require a little bit more than others, and it's cool to be able to have to kind of work through that.
Yeah, absolutely. And I just thought of something else. Do you see a difference between women and men, like female and male pilots? Do you see a difference between that, or are the problems pretty similar overall because of the way the job works?
A lot of times I see similar but different. I think my women not to bias, but I think that women sometimes are a lot more apt to get help. So I've worked with a lot more women than I have men, but I think that that's because women are more so, they're like, okay, this is what's bothering me. I'm going to seek help to get it. There's actually studies that show that women do that as well anyway, that they're going to seek that healthcare provider just, but I think that some of that is that we're just in tune, versus men are always not as they communicate, but they're not as forthcoming all the time with the symptoms and what they're feeling. Sometimes they think, "Oh, it is what it is. I'm just gonna work through it and we'll get there." So a lot of times I'll catch men way later after something has happened. Women tend to come to me way earlier. So sometimes it's easier actually to treat something in more of that acute stage versus something that's become a little bit more chronic, just because once chronic, you're like, okay, great. It took us at least 3+ months to get to this point. So now I've got to try to undo and work through that 3+ months worth of pain and what the body does when it's in pain versus, something that happened maybe like 1 to 2 weeks ago. Let's catch it early and we can already start moving in the ways that the body needs to heal. And we're going to be, steps and steps ahead of the game on that one.
Yeah.
So, and
And then is it pretty similar between the two? Like, as far as, like, the actual physical problems between, like, pilots, is it pretty similar between the 2 men and women because of the job type? Or is the physiological difference actually make the pain types different? Is like, a little more specific question.
no, yeah, no. So no, most of them are very similar, if not the same. Yeah.
Mm.
It's just how a lot of it is how it's being worded and how it's being described. That's where your difference comes into. But a lot of times you're going to treat relatively the same. Women versus men when it comes to kind of like hip and low back stuff. Women's hips are actually different than men. We have a much more significant angle compared to men where they're a little bit more straight. So a lot of times it's like we'll see, women will feel a lot tighter sometimes because some of it is because I think you're more in tune to it, versus, men that, they don't always stretch as well as they should. And none of us do. Like a lot of us are really bad at stretching, but it just kind of, a lot of times I'm going to treat relatively the same, but it just depends on the symptoms and what their major complaints are.
For pilots or anyone listening right now, or who are feeling from like neck pain, back tightness, like you mentioned from the cockpit, what's one simple thing that they could do right now, maybe even between flights?
Yeah. So, I mean, there's so many simple little things that we can do. But
I don't know if you're able to choose one.
if I had to choose one, it would be take the walk between your flights. When you get to your next flight, your next cockpit, take a moment and do like a quick stretch prior to going in there. Whether you're standing, trying to kind of like reach down and touch your toes, reaching up towards the sky, just some little kind of mobility thing like that. And what I'll do, Mercedes, is I'll have like a little guide at the end of this, that if listeners want the guide, we can send it to them and it will have kind of, my top 5 to 10 exercises that I love to give folks, and kind of like that pre-cockpit kind of like not even necessarily a warm up, but like routine that just helps prep you for that flight and those recommendations. So that way then there's a little.
Fantastic. Yeah, that's some great advice right there. Now, what's next for you with Skyline Wellness? Do you have any exciting projects or new ways that you're thinking about keeping the aviation community more flying pain free?
Yeah, so I've got a few things that I'm working on and a few ideas that I'm toying with. As people talk to me, one of the things that I'm working on putting together is just kind of like a little guide. I want to enhance the guide that I already have for mobility, but I want to add components of, recommendations for nutrition and things like that I'm hoping to have done by the end of the year. That would be awesome. I want to make it, I'm trying to make it all inclusive and, look up the best evidence so that way it is all, it's all researched and, it's great for this community. But I'm also just trying to listen to this community as much as I can and, take in their concerns and, questions that they have, and just try to build out programs that are the best for them. So, if anybody listening to this also has, questions or ideas that they want, from a physical therapist side of you, or somebody who's just in the fitness industry, I would love to hear those questions and field those questions and just help create things that are going to be wonderful tools that this community can use from here, and just keep building on those tools.
Well, I am certainly looking forward to seeing how your Skyline Wellness starts growing and building, and I can't wait to see that tool package come to fruition. I'm very excited to see where all of this goes. I'm sure you're going to help a lot of people, possibly even myself.
I hope so. That is the goal. Like, I started this because I just, I wanted to help this community, and now that I'm a part of it and inundated in it, it's like it's the community has become near and dear to my heart, and I want to see everybody, whether it's pilots or flight attendants or their families, like just being there, since I see both sides and I get both sides, and being able to help them and now be part of that it's really cool, and it's something that I want to just help grow and foster.
Well, thank you so much for coming on and sharing all of your knowledge and wisdom in this very niche environment for health and wellness. I really appreciate you coming on and sharing all of this with us.
Oh, well, thank you so much for having me. I was so excited to do this, and it was great.
A huge thank you to Dr. Jackie White for sharing her expertise with us today. If you're walking away with a sore back and zero excuses, that's exactly the point. Find Jackie and Skyline Wellness and grab her free mobility guide. Links are in the show notes. And if this episode helped you, share it with a pilot who you think really needs to hear what we talked about today. Leave a review and follow us on Instagram. Remember to fly high, dream big, and I'll see you in the next episode.